As we begin the new year, many of us are going to be making some New Year's resolutions. For some, maybe that's to quit smoking. This morning, we take a look at some of those products that can help. Nicotine patches, gum, and lozenges, just some of the items that can help people in their effort to quit smoking. There's also prescription pills like Chantix. Using these types of products is known as nicotine replacement therapy, or NRT.
I think the top two things that we probably prescribe the most are Chantix and the nicotine patches.
Sara Spesard is an advanced practice nurse at Horizon Health's Occupational Health Clinic. She helps people put down that cigarette. Besides using NRT to help kick the habit, she says smokers need to make lifestyle changes.
It is a social aspect for some people. So yeah, we do talk about lifestyle modification and see if we can help them in that way too, to give them some different alternatives.
According to the Centers for Disease Control, 1 out of every 5 deaths in the U.S. smoking related. Smoking leads to disease and disability, from cancers to stroke. But the number of people who currently smoke has declined from nearly 21% of adults in 2005 to about 14%. Sara knows quitting is not easy, but encourages smokers to keep trying.
Some people will quit smoking and then, something happens in their life and they become really stressful and they start smoking again, unfortunately. But there's always those options to try and quit.
And e-cigarettes, of course, a hot topic as well right now. The Centers for Disease Control say additional research needed to help understand the long-term health effects of vaping. But whether you smoke or vape, Horizon Health's Occupational Health Clinic encourages you to ask your doctor or nurse practitioner for some options to help you quit.